Have you been told that you have cervical instability and you've done a ton of strengthening and physical therapy work and nothing makes your instability better? Here you're gonna meet my good friend and patient Lori, who is 55 years young and has had left-sided C2, C3 pain for over 15 years, where she sits at a computer and works for an hour and then needs to lay down because she feels like her head is too heavy. Guess what? The answer is that she has had a ton of adhesion in her neck and her upper back and her shoulders and her chest. And here we're 16 treatment visits in and she's 90% better. You're gonna see my assistant James do a bunch of information collecting with her, do a few examinations with her, and then I jump into treatment, removing adhesion from the front of her neck in this treatment visit.
Visit 16, you made it.
I can't believe it.
How are you feeling since last treatment? Better, the same, worse?
A lot better.
Oh, great.
Yeah. Mm-hmm.
Last time you were here, you had 88% overall improvement. Would you say 90, 95?
I would say 90.
Great.
Mm-hmm. I don't feel the pain when I turn my neck. When I turn
moving?
my head to the left, I feel it here.
On the right side.
And then when I turn my head this way, I'm feeling it here as well.
This is visit 16 of Lori's case. Our cases are all 16 treatments long, and usually after 16 treatments, people purchase the longevity package, which is cheaper than the original case fee. And what's really cool about Lori's case, like we said in the intro, is that she's had chronic neck pain at the C2, C3 area on her left side for the past 15 years. So anytime that somebody says that their primary spot is gone and now they have a new spot, we Adhesion Release Methods providers call that unlayering. The body is like an onion with layers of compensation. The longer somebody has chronic pain, the body will try to work around it, develop a new compensation, then keep overutilizing other tissues until everything peters out and there's no other tissue to use. So we've unlayered the worst issue that she's had for 15 years, and now she's feeling it more on the right side, which is really awesome.
And computer work, any issues with that? Still tightness up
I think
here?
if I did any computer work. No, not that I noticed. It was pretty
Okay,
good
great.
that day after, yeah.
When we do the initial consultation with any patient, we always get a diagnostic hypothesis after getting the 7 first-order data points. And one of her provocatives was after computer work, after 60 minutes of computer work, she'd have to lay down. So she just said that she was able to do her computer work for a day and not have any symptoms. So this is what it's all about. Sustained permanent pain relief means that people can go back and do the activities they want to do and not have to stop them.
Good. What do you feel right there?
Nothing.
Awesome.
I know, right? I can't believe it.
Good. What do you feel there?
A pull right here on both sides.
On both sides?
Yeah, both sides. So like here
Got it.
and here. So
Got it.
maybe a 1.
2 on the right, 1 on the left. What do you feel there?
Yeah, actually it feels okay.
Nothing in the back of the shoulder?
No.
Notice all the testing we're doing with Lori to fully discharge somebody so that they need as minimal treatment as possible over the long term. They get sustained permanent pain relief. We have 5 cervical neck tests, 3 thoracic tests, and 1 shoulder test that all need to be as close to 100% passing as possible. So in this re-exam during this treatment visit, you're seeing 4 or so tests that James is doing right now to make sure that we're getting as close to 100% as possible. Are we gonna get 100%? No. It's just about getting as close as possible. The range of motion will dictate how much symptoms she's gonna have in the future. So this is longus coli. She's doing 90% better. She's doing super well. Her symptoms are pretty much always up here. Anything we can do to unload the front of the neck and take stress off here to remove the adhesion so that this stuff isn't being all pulled down is gonna cause this to work less over time. And this longus coli is often neglected by a lot of providers because it can be scary. The trachea and esophagus are there. What's that called? The carotid arteries right there. So you have to feel the pulse and then you move the throat out of the way. And then you can get into here and feel where longus coli is. And then also longus coli can be attached to the carotid artery. So sometimes if this causes a dizziness or some other type of symptom, you remove the adhesion and then that symptom can stop bothering the person. The back of her levator scap up top here
Feels like
Oh,
it's stuck
did
to
you
the
feel that?
underlying tissue. I didn't.
It's like a little pop.
$40 at the door. Chiropractic joke.
Because of the nature of Lori's initial injury when she was 10 years old, I could feel the facet joints at C2, C3 are much thicker and bonier than they should be otherwise. This is hallmark osteoarthritis. Therefore, what I'm doing now is I'm treating the rotatories muscle. Any of the small stability muscles are more important when somebody has joint arthritis like this, and it's more important that they be clean and adhesion free because they need to stabilize the joint.
Okay.
Mm-hmm.
Two passes.
74. Before it was 69 in the beginning.
Oh, really?
Yeah.
That's good.
Yeah.
You know, I like to see the progress.
Yes, you do. What do you feel there?
I don't feel anything.
What do you feel there?
Just a teeny tiny pull right here on the same spot, but
Got it.
with maybe a 0.5.
Got it.
Lori said it used to be like a rock. I said this is so much softer. That is the entire goal of treatment, that people can notice that their tissue gets softer over time, not just within the treatment visit, because it needs to get softer within the treatment visit, but from visit to visit to visit, because only then can we expect permanent sustained relief. But I'm super happy. with
Yeah, me too. Unbelievably happy. Like, I can't believe I can like move my neck now and not always be aware of this pain and throbbing. So thank you. Appreciate it so much.
If you want to see the full video, click the link over here.